Lily-Rose Depp, born 1999, has been in the public eye from a young age, the daughter of Johnny Depp and Vanessa Paradis, and over recent years, there has been increasing speculation about whether she has undergone plastic surgery or cosmetic treatments, despite still being quite young. In this article, we'll explore the rumors, what evidence exists, the possible motivations behind cosmetic procedures for someone like her, and the broader context of celebrity culture, appearance pressure, and youth. The rumors and speculation. There is no confirmed public admission by Lily-Rose Depp that she has undergone major plastic surgery. However, numerous websites and clinics specializing in aesthetic treatments have pointed to changes in her facial appearance as prompting questions. For example, an aesthetic clinic article observed that her cheekbones and sculpted facial features appear to have changed in a way that might reflect cheek filler or other injections. Dr. Lana entertainment sites have asked rhetorically, has Lily-Rose Depp had plastic surgery? Noting that the transformation might or might not be due to natural aging versus cosmetic enhancement. Yahoo Plus One, on Reddit and other forums, fans and critics have offered opinions like, before filler and nose tip refinement she was so beautiful. She already looked perfect but then got all this surgery which made her look worse. Reddit. These comments, while subjective and unverified, reflect the strong public interest in the subject. What exactly is being speculated? The typical changes pointed out include more defined, unsculpted cheekbones, leading to speculation of cheek fillers or implants. Dr. Lana Plus One. A more angular jawline or slimmer mid-face, which could reflect buccal fat removal or facial slimming treatments. Reddit Plus One. Slight changes in the nose shape. Some believe a refinement may have occurred, though evidence is less direct. Fandom Wire Plus One. Fuller lips or changed lip contour. Some mention lip filler, though again unverified. Fandom Wire. It should be emphasized that none of these claims are certified by Lily-Rose or her representatives. The logic often used is, we notice a difference compared to earlier photos and speculation that the change goes beyond natural maturation. Why while too young? The underlying question. One reason this topic attracts attention is the implied question. Why would someone so young, in her 20s, undergo cosmetic enhancement? What might motivate it, and is it problematic? 1. The celebrity and modeling landscape. Lily-Rose Depp has worked as both a model and actress, growing up under public scrutiny and in the spotlight from a young age, with famous parents, major fashion brands, etc. The fashion and entertainment industries place high emphasis on appearance, unique facial structure, look, and maintaining marketability. In that context, being youthful and fresh may not be enough. There is pressure to stand out and conform to aesthetic ideals. Adolescence and the early 20s are years when many start to feel pressure about their looks, cheekbones, lips, skin, nose. An inherited prominence as the daughter of two famous people comes with expectations but also comparisons which may drive someone to feel they must upgrade or refine their look. Natural aging versus enhancement. Some of the changes observed could indeed be attributed to natural maturation. As faces settle, people lose baby fat. Their bone structure becomes more defined. Makeup and styling choices evolve. Things like weight loss or gain, lighting, camera angles all contribute. The question is whether the change is beyond what one might expect naturally, as one article put it. Whether or not that can be attributed to her looks changing due to growing up and into her adult years or cosmetic work remains a mystery. Yahoo. Hence, the phrase too young may reflect concern that maybe she didn't need enhancement and could have waited or not done it, if she indeed did. Psychological and social pressure. There's a broader context. Young celebrities may feel pressure to maintain not just attractiveness but also distinctiveness. Reasons might include wanting to feel in control of one's image when so much of one's life is public. Trying to step out of a parent's shadow, in Lily-Rose's case Johnny Depp, and create a distinct identity. Appearance is one way. Some of the speculation about her enhancements link it to the idea of looking different or model face. Fandom Wire. Influence of social media, filters, beauty standards. Even though she is young, the pressures of visibility may push someone toward early cosmetic decisions. Risks and debates. Critics argue that early cosmetic procedures can lead to issues, unrealistic expectations, overtreatment, dependency on aesthetic fix-ups, loss of natural variation, etc. If someone is very young, there is also the argument that they have many years ahead. Natural changes will continue, so doing something irreversible early could complicate things later. Supporters or neutral voices say, if someone understands the risks, chooses treatment safely and realistically, there's nothing inherently wrong with it. In the absence of confirmation, speculation itself can be unfair. What we know versus what we don't know, what we know. Lily-Rose Depp has publicly credited her parents with teaching her skincare, said she started caring for skin from age 14 to 15. Fandom Wire +1. She has not publicly confirmed any major plastic surgery procedures, e.g., full rhinoplasty facelifts as of available materials. Aesthetic clinics and articles are pointing out possible changes, cheeks mid-face. But these are speculative, unsourced, and not verified by medical professionals with access to her. Some of the evidence is visual comparison of photos, which is inherently imperfect. Angles, lighting, weight change, styling all affect appearance. What we don't know, if any procedure was done, what exactly it was, filler, implant, surgery, etc., when any such procedure might have been done, if at all, the motivations, personal thoughts, psychological context, unless Lily-Rose speaks on it, but there's no credible public record of such. Whether changes are wholly natural, growth, makeup, styling, or partly cosmetic. Therefore, we must treat the plastic surgery suggestion as rumor rather than confirmed fact. Possible motivations. If one accepts the scenario, assuming for the moment that Lily-Rose Depp did undergo some cosmetic enhancements in her early 20s or late teens, what could her motivations have been? Refinement rather than remake. She already has a strong natural bone structure, inherited. The enhancements speculated, cheeks mid-face, might have been subtle, designed to refine rather than transform completely. Career considerations. As a model and actress in her early career, perhaps she or her team felt that a slightly more defined look would help in high-fashion editorial work or in roles, or simply align better with industry standards. Personal image control. Being born into celebrity, one can feel the need to shape one's own image distinct from one's parents. In the article referenced earlier, one headline framed it as, "Has Nepo baby Denier Lily-Rose Depp done plastic surgery to look prettier? Get out of 59-year-old dad Johnny Depp's shadow?" Fandom Wire. That suggests a narrative changing appearance to assert independence or differentiate. Peer and societal pressure. Even though she is young, 20s are a period when many women feel pressure around looks, aging, maintaining youth, staying relevant, etc. The celebrity environment amplifies those pressures. Aesthetic satisfaction. Some simply choose small cosmetic changes because it makes them feel better. The idea isn't always need but want, smoothing a feature, enhancing something they like, aligning their external appearance with internal self-image. Preemptive aging, maintenance. Some young women in high-visibility roles undertake minor non-surgical or surgical procedures early to stay ahead of age-related changes. If she had cheek fillers, for example, that might be framed as maintenance rather than corrective. The too young argument. Pros and cons. Pros of doing or considering cosmetic enhancement in early 20s. Less invasive if you catch early signs of volume loss or asymmetry, can provide confidence boost, sense of empowerment. When done properly, can be subtle and results may look natural. In a career where appearance matters, perhaps strategically timed. Cons. Concio risks of doing it too young. The face is still changing. Bone structure, fat distribution, skin elasticity will shift, so enhancement done early may look off later. Potential for overtreatment. Starting early could lead to a cascade of procedures, unrealistic expectations. Psychological risk. Mixing self-esteem with external changes may amplify vulnerabilities. If public figures do it, they may face scrutiny, speculation, judgment. Why so soon? Were you not good enough naturally? Etc. Cost and maintenance burden. Some procedures require repeated upkeep, and starting young means longer horizon of expense. In the case of Lily-Rose Depp, the too young concern seems to be mainly about whether she needed enhancement, and whether doing so early sets a precedent or receives unfair judgment compared to older celebrities. Broader context, celebrity, nepo baby, beauty standards. Lily-Rose Depp's case is also interesting because of the broader cultural context. Nepo baby discourse. As the daughter of Johnny Depp and Vanessa Paradis, she is often cited in discussions about nepo babies, children of famous parents who get access to modeling, acting opportunities. The aesthetic speculation ties into this. If you already have privilege, does enhancing your appearance amplify that privilege? Social media plus beauty filters. Younger generations, including celebrities, face the amplified effect of filters, perfect images, so the baseline for how I look is shifted. This might increase desire for real-life aesthetic enhancements. Fashion modeling demands. High fashion frequently demands unique, strong features, cheekbones, angular jaws, etc., that may push someone to accentuate features rather than just rely on natural. Public scrutiny and comparison. Every change is captured compared with earlier photos, dissected. For someone at 20-something, this can magnify even minor difference into a speculation frenzy. Evolving conversation about plastic surgery. While 10-20 years ago cosmetic procedures were more secretive, now many celebrities are more open, although Lily-Rose has not explicitly confirmed. The shift is toward more nuance, enhancement rather than dramatic overhaul. Seeing a younger celebrity with possible enhancements may trigger cultural debates. Should we celebrate autonomy or caution the rush? What she has said, her public stance is mentioned. Lily-Rose Depp hasn't directly confirmed major plastic surgery. Some of her public comments, she said, "I think that the younger you start to take care of your skin, the better. Your skin will thank you for it later. I've always tried to take care of my skin ever since I was 14. 15, Fandom Wire." On her lips, which some speculate were enhanced, she said, "I always do my lips myself because I think I always grew up watching my mom do her own lips. For me, it's my lips. No one knows exactly what I want except for me." Fandom Wire. These quotes emphasize skin care and lip care, but stop short of admitting procedures. Whether these remarks are intentionally vague, to avoid speculation, or simply reflect truth remains open. Alternative explanations. What might account for the changes, even without assuming surgery? There are plausible alternative explanations for visual changes in Lily-Rose Depp's face. Natural maturation. Faces evolve from teens to 20s. Fat distribution changes. Cheek hollows deepen. Bone structures become more defined. Correct fitness changes. If she lost or changed weight, her muscle tone that could define cheekbones and jawline more. Makeup, styling, and lighting. High fashion photography, contouring, makeup, lighting, camera angles all make dramatic difference. Aging skin and lifestyle. Starting skincare early, as she says she did. Plus modeling exposure may lead to smoother skin, different presentation. Posture and expression habits. Someone with more modeling experience may pose differently, chin up, cheeks hollowed, making definitions sharper. Dental can orthodontic work. Sometimes changes to teeth or jaw alignment affect perceived facial structure. Because of these factors, many experts caution against jumping to surgery conclusions based purely on photo comparisons. So, did she need surgery? A value question. Whether Lily-Rose Depp needed plastic surgery is a subjective matter. Some considerations. At her age, she already has strong natural features. Many would argue she didn't need enhancement. She could remain very successful and visually striking without it. However, need in the cosmetic sense is rarely objective. Many people, celebrities or not, opt for enhancements for aesthetic, psychological, or career reasons rather than medical necessity. The more interesting question may be, did she want it? Did she see something in her reflection or career that she wished to refine? That is a personal decision. Public reaction often tries to evaluate need through a moral lens. Was she fine as she was? First, should she have waited? The tension here reflects broader debates about beauty, aging, and autonomy. What this means for us and younger fans. This situation, whether true or speculative, has broader implications. Representation of beauty and aging. When a young celebrity changes her look, via whatever means, it may send signals to younger people about what's expected or what changing face means. That can be positive, empowerment, or negative, pressure. Transparency and speculation. The fact that rumors abound but confirmation is absent means that for many people, the story becomes about judgment rather than the person's autonomy. That can be unfair. Media and body image, early cosmetic changes or the perception thereof, highlight how media coverage focuses intensely on appearance, especially for women in the public eye, and how that coverage can shape perceptions and self-esteem. Autonomy versus expectation. On one hand, individuals have the right to shape their appearance. On the other, there is a cultural conversation about whether younger people should feel rushed into modifications because the industry, environment expects it. Natural aging versus enhancement narrative. Helping people understand that looking different in early 20s versus late teens may be natural, can reduce unnecessary speculation and pressure. Final thoughts. In short, there are strong rumors and some visual evidence suggesting that Lily-Rose Depp may have had cosmetic enhancements, particularly in the cheeks, mid-face, lips, while still young. But there is no confirmed verification of major plastic surgery from credible, directly linked sources. The question of why would she do it while too young opens up complex issues about celebrity, appearance pressure, industry demands, personal autonomy, and the evolving nature of beauty standards. Rather than assuming a definitive yes or no, the more constructive angle is to use this as a case study in how society views young women's appearance, how enhancement is framed, and how we respond to changes, especially when those changes occur in a public person under intense scrutiny. If friends, subscribe the channel, and I wish you good luck. You should take care of yourself.